video, you will learn the steps to take to create a smooth patient onboarding process so that you can put your private practice on autopilot. Hi, my name is Liz. Don't forget to hit the like button and subscribe to my channel so that you get notifications of future content.
Hi everybody. So let's talk today a little bit about onboarding new patients in different ways that we can put your practice on autopilot. Okay, so one of the first things that we are going to talk about is streamlining your documentation and your paperwork. So the first thing you want to do is evaluate your current onboarding process and all the paperwork and forms that you're using. You want to identify areas that you can improve on and or consolidate some of those steps. And of course, there are ways that you can digitize and automate those steps as well. You want to also simplify, reducing the burden on patients and ensuring that only essential information is collected. As a patient, I know I've been to doctor's appointments many times where there's like a book of 5 pages to fill out, and it's extremely overwhelming, especially the first time in a clinic because you don't know how the doctor's going to be or the nurses, and it can be a really nerve-wracking thing. Obviously, you want to consider implementing some electronic medical records or electronic systems to help you automate this process. This allows patients to complete forms a lot of times before they ever walk into the clinic. And sometimes that can be a good thing because it's a little less intimidating than having to complete everything in your first visit. This also can improve your efficiency and save time. All right, let's take a look at the next thing. So now we're going to want to look at enhancing your communication and the education with your patients. So in any practice, you want to make sure that you have clear and concise patient communication paths that are predetermined and that patients understand easily. So you want to let them know what the expectations are from them and what important information that they need in order to come in to have their visit, and what important information that they need to bring to their visit and what you're going to share with them. One great way to actually do that is a welcome packet. I actually do that with all of my clients, and it's another great thing to do with your patients. So you can have different things included in that welcome packet. You want to have details about your practice, your policies, your procedures, and your different services. I would make sure to include what you're expecting from that patient and what they can expect from you. Next is going to be your educational materials. So one great way to do education is to actually record an education with your patients so that they can view it later. Especially the older the patients get, they don't always remember all the details, for instance, of maybe injecting their own insulin, or if they need to clean a wound a specific way. You can put that training on video for them so that they can then view it from their electronic system later to kind of gain some more confidence. All right. Now we're going to take a look at optimizing your scheduling and appointment setting. So you want to make sure when you are doing appointment setting for your patients that it is an efficient system, and a lot of times digital as well. As a matter of fact, I know very few that don't use digital systems nowadays, and things like text messaging so that they know the day before that they're supposed to be to the appointment. I really like my MyChart because I can go in there and I can look at all my appointments, and you can provide something similar to MyChart. A lot of the electronic medical record systems now include that kind of a thing because of how powerful it is for patients. It also reduces, the amount of no-shows for your appointments. And in the medical field, no-shows can often mean a degradation in quality of care, which is not something that we want to do. All right, and then we also want to offer flexible scheduling for your patients, things like online appointment booking. Just last night, in the middle of the night, my mom decided that she needed a doctor's appointment to address something tomorrow. And rather than having to wait until the clinic opened up to call them, I was actually able to schedule it. I think it was like 3 o'clock in the morning. We scheduled her doctor's appointment, and now she has that doctor's appointment. So that's one great way of offering a flexible scheduling option. You can extend office hours in the morning or at night for people that maybe are not tech savvy and need to call in. That's another thing to keep things a little bit more flexible for your patients. Something that we want to also keep in mind is providing clear instructions for your patients. So for instance, if they do have to fill out paperwork before their appointment, make sure to let them know that they need to do that. And maybe even, maybe send a reminder text that they have to get their, paperwork, their initial paperwork completed for you. And if there are medication bottles that are expected to, a lot of times I have to bring all my medication and my vitamin bottles to new appointments. Make sure to let them know that they need to do that. If they need to be fasting for any kind of lab, work or anything like that, again, make sure to let them know that. And you can utilize those automated scheduling processes to do that. So that's another place where that comes in really handy. All right, so just a few things to remember. Continuous feedback and evaluation is extremely important and crucial for ongoing improvement. This isn't a one and done thing. You need to be doing it continually. Regularly assess the effectiveness of the onboarding process by seeking patient feedback. I also recommend that you get feedback from your staff to see how well it's working for them or if any adjustments need to be made. Other things that we want to look at are patient satisfaction scores, appointment wait times, and then make any necessary adjustments based on feedback received. Thank you for watching. Document it, delegate it, get it done.